Okay, welcome. Good morning, afternoon, and evening. You're joining TCI Nigeria's third webinar on local approaches to driving sustainable demand for family planning. We'll promptly begin in 3 minutes. As you enter the space, your mics are going to be on mute and they will be muted the whole time, but please feel free to introduce yourself via the chat. You just need to type in where it says all panelists and attendees so that we can learn who's joining us today. We'll get started in about 2 minutes. Thank you.
Good afternoon, everyone. TCI Nigeria welcomes you to this webinar, where we will be discussing local approaches to driving sustainable demand for family planning in Nigeria. My name is Norma Anyeto, and I'll be your moderator for today. Before we dive right in, I'll be doing a brief introduction of the Challenge Initiative. The Challenge Initiative supports states in Nigeria to execute proven to work reproductive health solutions using a business unusual approach. TCI works in 11 states in Nigeria and supports state governments to implement reproductive health solutions with 3 major areas of focus: advocacy, demand generation, and service delivery. The initiative integrates adolescent youth sexual and reproductive health programs in all its supported states and uses its research, monitoring, and evaluation program to evaluate interventions and provide evidence for its work. Today, our webinar will be focused on TCI's demand generation efforts. Specifically, we will be discussing local approaches used by TCI to drive demand for family planning sustainably. All the participants at the webinar will be introduced to TCI's demand generation strategy and introduced to indigenous approaches that can be adopted to drive demand for family planning on a sustainable basis. We will be listening to 4 speakers during this webinar. Our first speaker is Mercy Negoge. Mercy is the state health educator in the Taraba State Primary Healthcare Development Agency. She has 30 years of experience working as a Chief Community Health Officer. She is also the Secretary of the Taraba State Social Behavior Change Communication Committee, where she works to ensure that demand generation activities reach their target audience. Mercy, you are welcome. Our next speaker is Victoria Ibe Mohammed. Victoria is a public health practitioner with vast experience in implementing social behavior change interventions. She's also the TCI Demand Generation Technical Support Lead for Taraba State. From Bauchi State, Nigeria, we will be listening to Ribadu Mohammed. Ribadu is the Deputy State Health Educator of the Bauchi State Primary Healthcare Development Agency. He has over 25 years of experience in health communication, and he coordinates implementation of social mobilization for all program areas in Bauchi State. Ribadu, you are welcome.
Thank you. You're welcome.
Finally, we will be listening to Bebe Hua. Bebe is a social and behavioral change communication expert with over 8 years of experience in rural and community development, media and content development, and social behavior change communication program management. He is the TCI Demand Generation Technical Support Lead in Bauchi State. Bebe, you are welcome. Thank you once again for joining TCI Nigeria. We are going to be discussing local strategies for driving demand of family planning services sustainably this afternoon. Before our speaker starts, I will introduce Olumide Adefioye to introduce TCI's demand generation strategy. Olumide Adefioye is the Social Behavior Change Communication Officer for the Challenge Initiative, and he will be providing a short introduction to TCI's DG strategy just before the speakers come up. Olumide, please.
Thank you very much, Neoma. Hello, everyone. I'll be giving an overview of the demand generation strategy of TCI Nigeria Hub. As a hub, TCI Nigeria envisions a state-led and institutionalized social behavior change systems and structure in Nigeria. Now, what are we doing to achieve this? We utilize 3 key strategies towards the achievement of this vision. The first strategy is strengthening system and capacity for state-led SBC programming. Under this approach, TCI Nigeria has worked with state ministries of health and state primary healthcare development agencies to set up and to also strengthen the capacity of SBCC committees and technical working groups at the state level, while these committees and technical working groups have also cascaded the capacity building interventions at the LGA, at the ward and community levels. The second approach is media engagement for social behavior change and demand generation. To promote behavior change and demand generation for FP services, media campaigns have been conducted and they are still ongoing. The media campaign is a 2-pronged approach that includes the hearing of FP spots on selected radio and TV stations, as well as regular feature on media programs by SBC and FP stakeholders in the state. The third strategy that I'll be speaking on is engaging and mobilizing community for increased demand. We recognize the fact that communities and households are spaces where behavior change takes place and a vital target of social mobilization activities. Therefore, TCI Nigeria has strengthened capacity of states to plan, to implement, and to monitor social mobilization activities. We've also built the capacity of states to focus on high-impact social mobilization activities using data. As a result, the states now lead the design, the implementation, and the monitoring of these social mobilization interventions, as the subsequent presentations in this webinar will reveal. Thank you. Back to you, Neoma.
Thank you, Olumide, for that brief introduction. For people just joining us, we are discussing local strategies for driving sustainable demand generation for family planning in Nigeria. Our first speaker is Mercy Megoge from Taraba State, and she's just about to take the floor. Mercy, please.
Thank you very much, our moderator. Good day, everyone, and welcome to this webinar. I'm excited to be sharing our demand generation experience from Taraba State. And our topic for today is on diffusion of high-impact social and behavioral change intervention in Taraba State. The background. In Taraba State, there is a strong focus on social mobilization in the implementation of a mix of social behavioral change intervention. Let me expatiate a little. Before the coming of TCI to Taraba State, the state has a strong focus on social mobilization in the implementation of a mix of social behavioral change intervention. The structure on ground for demand generation activity was the Social Mobilization Committee, SMC. Also, there was no approved term of reference in use by the committee. The committee had no developed work plan, but the one developed by the state head educator alone. The local government head educators were not part of the committee members. Implementation is led by the state head education unit with support from implementing partners and other stakeholders from the previous state social mobilization committee. However, implementation had a stand-alone approach and was not data-driven, leading to the request for the technical assistance from TCI by the states. And in this, the activities conducted by the health educators at the local government area were just one activity without being integrated. For example, when a local government area health educators go for sensitization in the community on routine immunization, he only sensitized the community on the routine immunization without being integrated other health interventions into his sensitization. That was what led to the request of a technical assistance from the Taraba State from TCI by the state. And also it was not data driven. 5 LGAs were designated as demonstration LGA site for TCI high impact intervention. The intervention. Using family planning as an entry point, TCI worked with the state to access the demand generation landscape. TCI reviewed the existing demand generation landscape by reviewing all demand generation scope of work and the methodology used in carrying out its demand generation activities to create demand in the state. The second intervention was TCI engaged policymakers in the State Primary Healthcare Development Agency on the need to transition the Social Mobilization Committee into the State Social Behavioral Change Communication Committee with an expanded membership and scope. That means the TCI engaged the Director of Community Health and Executive Secretary of the Taraba State Primary Healthcare Development Agency with other key stakeholders on the need to expand the Social Mobilization Committee to Social Behavioral Change Communication Committee. And this committee was expanded to the total number of 33 membership, involving the following people: the 16 local government health educators, the religious bodies, the media, both print media and electronic media, the National Orientation Agency, the community and youth-based organization. The Women's Society also were part of the committee members. The state accepted the recommendation, thus setting the stage for a paradigm shift in social behavioral change program in the state. The steps that was involved in establishing the Social Behavioral Change Communication Committee in Taraba State are as follows. The first step was a time of reference was developed for the Social Behavioral Change Communication Committee. Membership criteria was expanded to include local government health educators and other key stakeholders, medias, and young men. Like I earlier mentioned, before the coming of TCI, there was no time of reference that was used by the existing Social Mobilization Committee. But with the expansion now, a time of reference was developed and membership criteria was followed duly as all health educators from the local government area were incorporated into the committee. The second step involved was a training curriculum was developed while notification of the inauguration of the committee was sent out. TCI organized the training for the committee and combined it with the inauguration, and a letter was sent to the relevant people involved, and the training was conducted and the inauguration was done. During the inauguration and the training, the committee developed its work plan. Another step was a community of practice in form of a WhatsApp group was set up for the committee members. And also, consensus was reached by the committee to hold quarterly review meetings in which data review and use will be a regular agenda item and future. The committee agreed that quarterly they will be meeting to review the activities done and to also share ideas so that they can build their capacity. The diffusion strategy now. The first diffusion strategy was inclusion of all the local government health education into the Social Behavioral Change Communication Committee. The second diffusion strategy was the SBCC Committee work plan development. And the third strategy was set up of a community of practice. Diffusion through an inclusive SBCC committee. The composition of the SBCC committee was strategically done to include the local government area health educators from the 5 demonstration local government areas and 11 non-demonstration local government area. Taraba State have 16 local government, and out of the 16, 5 local government were selected as a demonstration LGL for TCI. And during the training, all the other 11 non-demonstration local government area health educators were brought together so that their capacity could be built and they could share ideas and improve on their demand generation activities at the community. This exposes all the local government health educators to the high impact, thus facilitating diffusion to non-demonstration LG because of the ideas they were sharing and capacity building. All the health educators were involved in creating demand in this community. Also, it also enabled all of them to be involved in the development of the committee work plan. Let me hand over to Victoria to expatiate more on the community demand communication strategy. Thank you.
Hello, everyone. I'll be discussing on some of the strategies that facilitated the diffusion of social and behavior change interventions across Taraba State. The first strategy was the inclusion of all the local government area health educators into the state SBCC committee, which was the first strategy that led to diffusion of high impact social mobilization activities across Taraba State. And the second strategy is the diffusion through the committee's work plan. During the inauguration, which was conducted for the state SBCC committee members, the inauguration was combined with a training. And in that session, a work plan was developed. And in developing this work plan, emphasis was made on 3 domains. And these domains are identifying high impact activities in each local government area. And the second domain was on integration, while the third domain was on leveraging. So the health educators identified that if sensitizations are conducted at neighborhood campaigns, at community association meetings, at religious places and indigenous events, as well as community meetings, these activities could be leveraged on in conducting family planning sensitization. And the second domain was on integration. The health educators identified existing health programs in their respective LGAs into which family planning could be integrated into. So all these activities were leveraged on for family planning. And these activities were merged together to form the state SBCC committee work plan, which was a year work plan that was developed. Another strategy that also led to diffusion of high impact social mobilization activities in Taraba State was through integrated mobilization. So this integrated approach enabled the health educators to reach more people with family planning messages by leveraging on existing health programs in the state. And these existing health programs in Taraba State are routine immunization, malaria, nutrition, WASH, environmental health and hygiene, maternal and newborn child health. Looking at another strategy that also facilitated diffusion in Taraba State was diffusion through community of practice. A WhatsApp group was set up by the committee to serve as a platform for continuous education and knowledge sharing. And this WhatsApp group also enabled members to provide implementation updates, as well as promote and encourage coaching on data use and documentation. So this WhatsApp group enables members of the committee to post activities conducted in each local government areas. So these activities are posted in picture or video clips with a detailed narrative on the date that the activity was conducted, the venue of the activity, the type of activity conducted, as well as the total number of people that were reached from that activity, including the total number of people that were referred from that activity. So the WhatsApp group is used in strengthening the capacity of the committee also on data documentation in terms of disaggregating social mobilization data using gender and age category amongst others. So all the health educators are also members of the WhatsApp group. So these stimulated healthy competitions as a result of activities posted on the platform. So this also facilitated the diffusion of high impact and social mobilization activities in Taraba State. So let's look at the intervention outcomes. Prior to TCI intervention in Taraba State, documentation of demand generation related data for family planning, that's in terms of the total number of people reached from an activity, the total number of people referred, and the total number of people completing the referral process was non-existent. But following TCI intervention in Taraba State, there was increased sensitization on family planning, as well as an increased uptake also. And this will be seen in the subsequent slides. So looking at the number of persons reached with family planning messages from the month of July 2019 to April 2020, we can see the 5 demonstration LGs is having a total of 42,809 persons that were reached with family planning information. When we say 5 demonstration LGAs, these are LGAs, local government areas, where TCI demonstrate its high impact social mobilization activities. And where we have the level non-demonstration LGAs having a total of 62,887 people reached with family planning messages are the local government areas where TCI does not demonstrate its high impact intervention, but as a result of diffusion, of bringing together all the health educators into the SBCC committee. This facilitated diffusion, and a total of 62,887 persons were reached with family planning information through social mobilization activities. So in Taraba State, imagine the total number of people reached from the demonstration local government areas and the non-demonstration local government areas, we have a total of 105,696 people were reached with family planning messages through social mobilization activities in Taraba State. Then let's look at the conversion rate, the number of completed referrals in Taraba State, still from the month of July 2019 to April 2020. From the 5 demonstration LGAs, we have a total of 10,548 persons that were referred to the health facility to assess a method or service, out of which 4,722 persons completed the referral. And this is translating to 45% of completed referrals. Then when you look at the non-demonstration local government areas, we have a total of 3,851 persons referred, and the completion rate is 3,387. This also translates to 88% of completed referrals. We could be looking at the 88 completed referrals as very, very high from the demonstration LGAs, but it is also interesting for us to note that the 88% stands for 11 local government areas, which doubles the 5 demonstration LGAs, where TCI is demonstrating its high impact intervention. So when you look at across Taraba State, from both the demonstration LGAs and the non-demonstration LGAs, there's a total of 14,399 persons were referred to the health facilities, out of which 8,109 persons completed the referral. This also translates to 56% of completed referrals. Then in looking at the trends of family planning uptake from the month of July 2019 to April 2020, as a result of social mobilization activities in Taraba, the blue curvy lines refers to the numbers of clients cancelled, while the orange curvy lines refers to the numbers of new acceptors. So when you look at from the month of July 2019, where we have a total of 7,221 clients cancelled, out of the 7,221 clients cancelled, there is a total of 5,092 clients that accepted a method, and the trend shows a steady increase. Where we have a fall, a decrease, is in the month of April, and this is as a result of COVID-19 pandemic and lockdown order in the state, where we have a total of 9,292 clients cancelled, out of which 6,285 completed the referrals as a result of social mobilization activities. So for Taraba State, looking at all these diffusion strategies that we've identified, we also pencil down some key learnings that can support and sustainability of demand generation activities in other geographies. And if these learnings are identified, it will increase demand, not just for family planning, but for all other health interventions. And one of the key learnings, the first one, is the expansion and the inclusion of all the local government area health educators in the SBCC committee. This facilitated rapid diffusion of high impact interventions. So the first stage was expanding the existing social mobilization committee into the SBCC committee. So bringing all the health educators, even those at the grassroots, were incorporated into this committee. So that was the first strategy that led to diffusion. And the second strategy was integration. So in Taraba State, activities are conducted together. It is no longer standalone. So when you're going for routine immunization, sensitization, or malaria, you also leverage and integrate family planning. So all health interventions are integrated together. And the third learning is the setup of the WhatsApp group as the committee's community of practice. So this WhatsApp group provides an avenue for knowledge sharing. Beyond that, it also provides an avenue for the health educators to give updates on their activities. So, and this is done in pictures, in video clips, and this also stimulates healthy competition and further diffusion of best practices in Taraba State. Thank you very much.
Thank you, Mercy and Victoria, the Taraba State team, for that beautiful presentation and the impressive results you have shown. Thank you very much. If you are just joining us, we are discussing local approaches to driving sustainable demand for family planning in Nigeria. And we have just listened to Mercy and Victoria from Taraba State, where they have told us what worked for them in Taraba State. We will now head over to Bauchi State, where we will be listening to Ribadu Mohammed and Bebe Hua, who will tell us the local strategies for driving uptake of family planning in Bauchi State. Ribadu, please.
Okay. Thank you, the moderator and my listeners. I'm going to be facilitating how local approach are driving sustainability demand for family planning in Bauchi State. The objective of this presentation is to show or bring our knowledge how effective community theater has been used to drive a sustainable demand, not just on family planning, but other primary healthcare services in Bauchi State, and can be applied to other geographies as well. The background: community theater is a form of entertainment that is usually presented in communities to entertain people during social events in Bauchi State. Those community drama groups are domiciled in various communities across the state as a form of entertainment. Some of those groups include such as Yankee Drama Group in Bauchi local government, Under Production in Katagul local government, Idomikia Drama Group in Alkaleri local government, Junior Bakisangwaniwa in Toro local government, just to mention a few. Because of the entertaining show by those groups, they usually have a large followers, and their drama presentation usually attended by community women, traditional and religious leaders, youths, and other spectators. The community theater is not only used as a form of entertainment, but it is also used as entertainment education tools to address educational factors. When and why? Entertainment education being supported by TCI, that is the demand generation strategy. The drama groups were mapped out during the identification of existing community structures to obtain family planning messages in Bauchi State with the technical support and coaching from the TCI. The strategy. With the support from the TCI, the SBCC Committee and the state provide a 2-day training for those drama groups across the 5 LGS, where TCI was supporting the state to demonstrate those concepts, including periodic coaching, visibility, and sustainability. The implementation. After building the capacity of those drama groups with needed skills, drama groups start sensitizing the community on family planning. For starting the drama presentations, a planning meeting was held to identify the venue and other logistics with the community leaders at Turun and Bayampada community. The objective of the presentation was to address religious and social bias of the participants and encourage uptake of family planning services. Awareness and community mobilization was carried out by town announcers, and community mobilizers prior to the events. Data source for evaluation was obtained at Turun and Bayampada Primary Health Facility 6 months before and 6 months after intervention to compare the trend of family planning services uptake in the two facilities to ascertain the effect of the drama in the community. Participants during the presentation are community members, traditional and religious leaders, women, youth people, men. Now I will hand over to Bebe, the demand creation support lead from the TCI supporting Bauchi State, to demonstrate this concept. Thank you.
Okay. Thank you, the moderator. Thank you, my listeners. So the outcome of the community theater as demonstrated in Bayamfada and Turun community. This was a total number of 15 public statements documented in support of child-based person by traditional, religious, and community leaders in Turun and Bayamfada communities. This sparked a discussion which served as one of the factors which address spousal communication and peer support in those communities. Among those statements, one of them was Serikin Bayamfada when he said, to tackle insecurity and crime in our communities, we must give birth to number of children we can comfortably take care of, if not adopt child-based spacing. This was one of the numerous statements in support of family planning that were documented at Turun and Bayamfada. Outcome 2, which is the discussion, which this was an instant approval. This statement said by these traditional leaders to couples and friends which attended the event. These are some of the ripple effects of what the community drama can do when it's presented with a good message in the communities. And then the other outcome, when the Serikin Turun said the child-based spacing, child-based spacing is the way to keep our own women alive. This was Serikin Turun giving his own support and speaking publicly. Most of these traditional leaders was the first time that they were actually speaking in support of family planning. There are a lot of the documented and published speaks, but we could just mention just few of them just to show. Data on the data evaluation. Just like the first speaker said, we obtained 6 months data from Turun facility and then 6 months after in the Turun facility and Bayamfada. And Turun is not a facility supported by TCI. Bayamfada is a facility supported by TCI. The reason for this was TCI conduct other social mobilization activities which enhance uptake of services. So we wanted to pick in a facility where there's no TCI strategy implemented apart from the community theater, which is this showed in the Bayamfada. You have from 204, it moved to 338, it moved to 370, 371. And then in Turun facility, the same thing from 30 to 61 before it started dropping. Now, the sustainability. On the sustainability, the drama group conducts sensitization for other programs apart from family planning currently in Bauchi State, because the effect and the impact the drama group has created. This encourage private individuals and organizations such as VVF, Viscovagina Fistula organization. The time they came to come and witnessed this drama when it was presented in Turum, saw the effect this has done to the community with the data shown. So they have now contracted this drama group to be sensitizing people for them in other local governments such as Tafawa Balewa, Genjua, and Kirfi. And one of these drama groups is called Yankee Drama Group. As mentioned earlier, these drama groups exist in different communities, different drama groups. The Yankee Drama Group, the one in Bauchi, has actually taken upon himself looking at the statistics of family planning in Bauchi State to be producing a quarterly family planning magazine, which is undergoing its final phase. This magazine is going to be including quarterly uptake of services of family planning in Bauchi State, and public statements by traditional and religious leaders, and then anything family planning. Bauchi State government currently partners with the drama group to sensitize the people, such as in April, they contracted the drama group in Katagum local government to sensitize the people on nutrition, wash, open defecation in Kirfi local government. And the drama group is actually officially included into the state demand generation strategy, which is now being finalized on activities that are going to be implemented in the next phase as an integral part of sensitization and behavioral change. Finally, community theater has been proven as a viable strategy for achieving sustained family planning uptake in Bauchi State, thereby contributing to the increased contraceptive prevalence rate. If adopted in other geographies, can and will be a well-good tool in increasing family planning uptake and making family planning a norm in Nigeria, Africa, and the globe at large. Thank you.
Thank you very much. Thank you, Ribadu and Dave, the Bauchi State team, for the insights into use of drama for family planning demand generation. I believe we have had very interesting presentations by the panelists. It is time for questions from the participants. Please put your questions in the Q&A section. I'll start off with the questions that are currently there, but if you have a question, please put it in the Q&A section. Okay, we have our question. The first is from Andrea, and it is to the Taraba State team. And she says, thank you, Taraba State, Mercy and Victoria, for the excellent presentations. From your perspective, what was/is the most promising results or change you have seen after the establishment of the SBCC Committee and State Strategy? How does the SBCC Committee and State Strategy help to expand access to family planning among those who desire to use family planning in Taraba State? I will be asking Madam Mercy this question, but I will take it a second time so that you hear it. Madam Mercy, from your perspective, what was/is the most promising results or change you have seen since the establishment of the SBCC Committee in Taraba State? And how does this SBCC Committee and the State Strategy help expand access to family planning among those who want to use family planning in the state? Madam Mercy, please.
Hello, ma'am.
Thank you very much. Okay, I will answer the question. Hello, can you hear me?
Yes, I can hear you, Victoria. Go ahead.
Hello?
Yes, Victoria, I can hear you. Go ahead.
Okay, in Taraba State, one of the striking promising results we have seen is increase in family planning awareness. and demand, and also access to services, as shown in the data where we have 56% of completed referrals in the state. So this is a wonderful effort from the state. And the strategy that was used in ensuring that these family planning messages get to the members of the community was mentioned earlier on through the expansion of the state social mobilization committee, which was in existence before. So it was expanded into social behavior change communication committee, where it had all the health educators in the state. From the grassroots, we are also members of this committee. So that led to diffusion. And secondly, we also have the work plan that was developed. So this work plan was a working document. It was a guide that facilitated implementation of activities in every local government areas. So that was the strategy that was used, and the result is the increase in awareness, demand, and access to services.
Thank you, Victoria. There are lots of other questions for Taraba, so just stand by with Madam Mercy. The next one also goes to Taraba, and it says, what explains the difference between the percentage of referrals completed between demonstration LGAs and non-demonstration LGAs? Basically, what she's asking is the difference between completed referrals. What is the explanation? Because you know, 5 demonstration, TCI demonstrates in 5 LGAs in Taraba State. What is the difference? Why is there a difference in completed referrals between the demonstration LGAs and the non-demonstration LGAs? Oh.
Thank you very much, Nyoma. The difference in the completed referrals from the demonstration LGAs and non-demonstration LGAs is from the non-demonstration LGAs, the referrals are targeted at specific clients who are convinced and who request for a family planning method or service. So the local government health educators target these clients who actually want this service and are convinced. This is the same approach that is used in the demonstration LGAs. But the only difference is that high referrals were recorded in the demonstration LGA as a result of lack of adequate information on the benefit of family planning, which was provided to the client by the social mobilizers during community engagement. So from the demonstration LGAs, there are social mobilizers who also support the health educators. So in order to strengthen the capacity of the health educators, TCI trained the health educators as master trainers on social mobilization strategies. For these health educators to now step it down to the social mobilizers in conducting community engagement. So during one of the SBC quarterly review meeting, it was noticed that we have higher referrals while the completion rate is very, very low. So that was when we discovered that it was as a result of insufficient information was provided to the clients by the social mobilizers during community engagement. So this subsequently affected the client's access to services. So during the meeting, it was not agreed that social mobilizers and health educators will work hand in hand, and the health educators will issue the referral cards. But in the non-demonstration LGAs, where we have completed referral rates, it is because the health educators give out the referral booklets, and because they command some level of respect, they are knowledgeable and they are easy to assess, and because the community members always see them doing community engagement, so they trust and believe in them. So that is why the completed rate is high. And we have adopted this learning from the non-demonstration LGAs. That is why there was a course correction that was done, that the health educators in the demonstration LGAs should also monitor and pay attention adequately to the social mobilizers and also issue the referral cards. So that is why we have high referral in demonstration LGAs, because some of the social mobilizers were giving out referral cards without providing adequate information. While in the non-demonstration LGAs, where the health educators do not have social mobilizers, give out these referral cards. So that is it. Hello?
Thanks, Victoria. That was extremely helpful. This is Lisa. I'm just checking to see if Noma's mic is working.
Okay.
And so basically, just to recap what you said, though, is essentially in the demonstration sites, you have health educators paired with social mobilizers. And unfortunately, the social mobilizers were handing out the referral cards without kind of sufficient information to the clients. While in the non-demonstration sites, the health educators targeted the client or potential clients with better information. And so you did a course correction in the demonstration sites so that ideally that the referral is given to those who are actually potential clients, but also more information is given to them on the actual facility so that they can make the referral. So I think that answers the question to a number of folks. I think Noma's mic is having trouble, so I'm going to jump in and ask a few more questions. While we have Taraba on, one final question for you at the moment, and then we'll have maybe a few others. But there's kind of two questions around the financial commitments related to establishing an SBC committee as well as like the social mobilization. So what were the commitments of Taraba State financially and materially to this collaboration? And specifically in terms of how are you able to utilize the LG health educators to create demand, bearing in mind that they are government workers and in most cases are highly involved in lots of activities? So were they paid wages for the tasks, or were they doing this at the directive of the government?
The Taraba state government, through the Save 1 Million Life Fund, provided some level of financial support for some of the community engagement. But for the health educators, they are not paid for any activities conducted in the local government because it's part of their job and they are doing it as part of their job. So they are not paid for that. The only fund released to support the activity is for the social mobilizers to be given a stipend on their social mobilization activities.
Great, thank you very much. And now I'm going to transition and ask a few questions to Bauchi State. So we have a question first about, you mentioned that there's community mobilization that needs to occur prior to the drama. And one of the questions is, does that happen just one day, or is there like over a period of time in advance? And how was there a series of dramas and activities that happened over a period of time in the catchment area for like the data you showed, or was it just one performance?
Okay, thank you very much. The mobilization of the communities happened 3 days to the drama presentation. The essence of the mobilization is to tell the community people that there's going to be a drama presentation. Initially, the presentation said community theater is usually used as a form of entertainment. However, as a TCI strategy to support the state, it can be used as a form of entertainment education. So they invite all the members of the communities. There's going to be a drama presentation down the village square. So everybody tomorrow, 10 o'clock, 12 o'clock, be there. So all that happens by town announcers and social mobilizers go around telling people, come to the venue. And it happened once. It was that once that it happened in Turum that we actually saw the posts in the service uptake. If we could get all the captions from the facility in charge when we went to do the analysis and get the to confirm from the facility, she told us that she wished this could be done on quarterly basis so that it can sustain the message for a period of time, which is what the state government is actually working on now. And they are doing an integrated drama presentation, which include family planning, ANC, and other PHC into the message that this will be staged in communities on quarterly basis to sustain the message. But for this data, it was a one-off presentation. We showed the data up for a month preceding the month presented.
Thank you. That's really helpful. And I think that also somewhat relates to another question in the sense of, with the government's interest and commitment to the drama groups being done maybe on a quarterly basis, in the era of COVID-19, in what ways do you think that this approach might need to be adapted, given gathering guidelines?
Okay. For instance, the last SBC committee meeting we had, we were deliberating on how we can use this drama in time of COVID-19, considering the guidelines given on social existence. So they were of the opinion of doing like a community cinema, where the drama is recorded and then presented in the community in smaller groups, no longer the whole community. You have the community has different streets that this could be presented to them. It was a discussion that we were still discussing in the last SBC committee we had. So it's still on it. Part of the drama actually got to the media. It's recorded in the audio form and is being aired in the media on other projects, including family planning. And specifically, I could tell WASH, Open Defecation and Family Planning is being on Arbaka Radio and Globe FM. But we're still discussing on the activities, because when it got to a level of recording it and staging it in the community in smaller groups as a form of a cinema, that started involving, there was financial implication, which the normal drama doesn't have. So that discussion is ongoing on how to balance the two.
Thank you. That's really helpful. And that relates to two questions for both of you in terms of Taraba State and Bauchi State. One of the questions relates to what's the role of the health educator as well as, say, the community drama group in terms of ensuring the facilities are prepared for the increased client volume after these types of activities?
Okay. The health educator coordinates all the activities at the LGA and the community level. So all the planning, the community engagement is actually done, but it's actually coordinated at the LGA level by the LGA health educator. So before a drama is presented in the community, he arranged meeting with the community leaders to choose the venue and other logistics. At this choosing the venue and other logistics, the facility in charge and the MCH coordinator of that LGA is usually in the meeting. So all the commodities at the facility, making sure the facility is prepared for the inflow of clients is being discussed at that level, and everything is usually in place for accepting clients before the drama is staged. It's usually planned concurrently, and the health educator at the LGA is usually at the coordinating position at that LGA level.
Hello?
Thank you very much. That's helpful. And Victoria and Mercy, do you have anything more to add to that in terms of how the health educator?
Everybody wants to add something.
Oh, sorry. Thank you.
Yes.
In addition to what Bebe has just said now, as he has just said it, the health educators at the LGA level identify all these local drama people that we are using in the community. As a part of this sustainability that we want to see how to sustain the program, that is why we are identifying these local drama people from that local community, so that we train them, we orient them on this aspect of either is it the family planning, is it the other PAC services, so that we can have a sustainability. They are coming from that community to orient their community on what they have been oriented, particularly on the health aspect. So these are some of the issues that we consider. Yes.
Thank you very much, Rabaju. And Mercy and Victoria, do you have anything to add as to how the health educators ensure linkages with the nearby services and facilities?
The health educators work together with the service delivery. They have a good collaboration. And so when they go out, they educate the community, they refer them, and they follow up to the health facility to be sure, to ensure that the clients comes to the health facility. And then if they don't come, the service providers call to rectify issues with them. So there's a good collaboration between the health educator and the service provider in the states.
Great, thank you for that. We'll have to take our last question now. We have collected the additional questions, so we'll share those back with the team and see if we can provide you with responses. So one of the asks I noticed in the chat window was for an example of the TOR for the SBC committee. So we can liaise with the team and get back to you on that. My final question that I'll take is, for both of you, what did you see as a key challenge? So I believe Victoria mentioned one of the challenges in like reviewing the data and recognizing that the social mobilization assistants might not have been as adequately trained, but was there any kind of key challenge that in implementing these strategies you had to address, and how did you address that? Or are you still kind of figuring that out?
No, can I speak?
Yes, please, baby.
All right, okay. For us in the drama, one of the key challenges, because we have to actually support the state on what is going to be sustainable. So the drama groups, now they used to do their activities on entertainment, which usually be at will. So they're picking up this challenge of making sure people are sensitized on child-based spacing. Therefore, more work needs to be put in terms of trying to make sure that all the community leaders are involved, the venue, and the logistics involved in rehearsals over and over and doing all of that. So now that at the moment, we have to show the state how this works without much financial implication, it poses a little challenge, but because they are in the community. So there were better ways of making sure that this was done. That's why the venue for presentation of the drama was usually in the village square or at the Seriki, the local chief's house. So there's no need for the venue. And then the local chief's house usually have shades. So you don't need to hire canopies. So the financial issue was an issue, but just like you said, these were some of the ways that we used to make sure we show the state that this is sustainable, and it was done successfully well. If my state counterpart has something to add.
Yeah, in the aspect of this drama still in Bauchi State, initially when the TCI come and start supporting us on how we can get all these other local drama people, when we start identifying them, the challenge we have at the beginning from the health educators, what they call us from there, they will tell us that they have identified all these drama groups from their LGS. But the issue of this, what we have started seeing is like how I seen like it's something that we are going to support them financially. But when we sit down during the orientation, we had a discussion with them. The orientation that we made for 2 days to them really helped us, that they know they are from that community and they can support the community on their knowledge that they have. Since they have this knowledge to create all this drama locally, why can't they can support their community with this little knowledge that they have. So they really impressed. They were seeing that it's part of something that they can be. This is something that they will be known by their community. They have something to do. So all these challenges that we have before we start engaging them. So we have these challenges. An issue of this, as how you were saying, how you can bring them with the basic key messages on this particular aspect that you want them to talk. Is there is need of orienting them so that to know definitely they want to talk really on that target, our target audience, the messages that we like them to pass. All this one, these are some of the challenges because they are not professionally on that aspect, but they know how to make the drama. You have to all make this by orienting them. So these are some of the challenges. Thank you.
Hi, Lisa. I was
Perfect.
logged out for a bit.
Uh-oh. And we don't hear you anymore. But on behalf of Noma and Lisa and the rest of the TCI Nigeria family, we'd like to thank our presenters today from Taraba State and Bauchi. This was a very informative and helpful presentation. We've recorded it and we'll make sure to post the recording along with the slides to TCI University and get that out within the next day or so. So thank you all again. We really appreciate you sharing your challenges, your learnings, and we really believe that these are approaches that can be adapted and taken up by others, not only within Nigeria, but elsewhere. So it was good to see so many attendees today, and we hope you have a wonderful rest of your day. Thank you so much. Bye for now.
Bye.
Bye, everyone.
Bye. Thank you.
Bye.
Bye-bye.
Thank you. Bye.